Good afternoon, everybody. My name is Jimmy Ha. I'm so happy to be here to introduce a wonderful colleague of mine, Suzan Walters. Dr. Suzan Walters, she's an assistant professor in the Department of Population Health at Grossman School of Medicine at NYU. And she's a faculty at the Center for Opioid Epidemiology and Policy. And she's also an investigator at the Center for Drug Use and HIV and HCV Research, and also a visiting scholar at Center for AIDS Prevention at University of San Francisco. And lastly, a lifespan Brown Justice Scholar at Brown University. So her research focuses on social and structural determinants of health among people who use drugs. And her current 301 focuses on the intersectional stigma experiences and how they impact the access and use of PrEP and among people who inject drugs in California and Colorado. And her research aims to inform HIV prevention, overdose, and stigma reduction interventions. So I've known Dr. Walters for about 6 years, and as in many of you in the room, I'm a big fan of hers. So and she's been very kind of passionate and committed to the cause that she's been studying. So please join me in welcoming Dr. Walters.
Thank you so much, Jimmy. One thing Jimmy did not mention, but should be mentioned, is she is a mentor on my KO1 and has very much helped me grow in my statistical understandings, which we're not going to talk about today, but I'm happy to answer any like stigma measurement questions or anything at the end. But for today, I'm going to talk about these visual methods and how it's not just art, but they're scientifically rigorous and socially transformative. So I'm going to hopefully walk you through how participatory visual methods like photo voice can illuminate stigma's real impact on people that have lived experience of drug use. It can be used with other communities as well, and how these can be used in research, but also as tools for change. I'm going to look here and try to look here because the camera for the Zoom audience is here. So hello to those online, and thank you for joining. So I think Jimmy gave a really great introduction. Thank you. Just to reiterate a little bit about that, I have a PhD in sociology, and I got that at Stony Brook University. So the way I see the world is very influenced by social behavioral theories, sociology, particularly ethnography, which I was also trained in, and an ethnographer. After graduating, I was always a little bit different in my department, though, because I was really interested in applied work. I was interested in how these social theories can be used in everyday interactions to help better people's lives, like immediately, preferably immediately, right? So it's always a little different. And instead of going the traditional route of going right into a faculty position, I went into 2 postdoc positions, focusing on drug use research, which was not an area that my department excelled in. Mostly we did a lot of gender theory, social inequality, things that are, typical bread and butter for sociologists. And I also really became involved with CEDAR, which is at NYU. It's the Center for Drug Use and HIV Research. And I've been working with them since 2018, and they've really formed a lot of how I view this work, and have really supported me in my work as well. And then now I'm a visiting faculty at UCSF. That's where I first learned about photo voice a little over a year ago. So I kind of about-faced in my research after going to a presentation at UCSF in a summer training program. And I also work with people who use drugs, who are criminalized for their use. So the more you talk with people and you understand them, it becomes apparent that the criminal legal system is greatly influencing their life and their health outcomes. And if we're not accounting for that in our research, we're missing a very big question. So I'm affiliated with, as a scholar, with Lifespan Brown, criminal justice training at Brown. And that's really enhanced my scientific knowledge and ability to measure and think about those experiences. So I want to talk a little bit about what you wouldn't find on a CV, though. And I'm going to start here. This is a picture of my family. My mother, I was born in California. California is very special to me. I love being here. Thank you for hosting me. It's, you know, it's really important to me on a lot of levels. One, because I was born here. So this is my family. My mother is to the left of me, and she is a single mom. So she's one of 6 siblings, or was one of 6. And she's alive, but another sibling is not anymore. And everyone pitched in. So everyone kind of raised me in a non-traditional way. And I was really kind of in the center of everybody's lives because of that. So I had a lot of love, and that's my aunt on top. It's her birthday. I mean, I was like in everything. My 2 uncles that are holding my hands, they're closer in age to me than my mother is to them. So, you know, a little bit of a different dynamic. I also had a different trajectory in my education, which I think is important as an academic to talk about. I'm a stigma researcher, so I'm going to be breaking barriers around stigma as much as I can in this presentation. So I started at a junior college and ended up getting my 4-year degree at UC Riverside, which I'm so excited. My undergraduate professor is here today. And yes, Dr. Steve Clark, who really influenced the way, and like circling back to criminal legal involvement, he is an expert on eyewitness testimony and the, you know, kind of troubles in our legal system and how that impacts communities. And then finally, I ended up in New York, where I met my New York husband, who is not here to talk, but has a very strong New York accent, and had my 2 beautiful children. So now I'm in New York, but very blessed to have a little California. And I share this, one, to, you know, just talk about non-traditional means, but also to share that a lot of people on this screen are people who use drugs and people who use substances, and who I love and loved me very much. And that's, I think, really helped me understand drug use in my work and how I work with different communities that are using drugs. So today, just a little bit of a roadmap. We're going to talk about stigma. I'll try not to be too theory heavy, but I'm a little theory heavy. Talking about photo voice, looking at some photos with visual data, a little bit of ethnography I'll pepper in, and then talk about some future directions and collaborations. And hopefully, as a group, we can talk about ways in which, you know, we could all collaborate in this difficult time to better the health of the communities we live in. Okay, so stigma theories, so just some frameworks for understanding our social world. I'm going to start here. This is a seminal book on stigma by Irving Goffman. And for Goffman, stigma was an attribute, a physical marker on the body, a behavior or reputation outside of quote unquote the norm. And with that came social devaluation and discrediting. People could be marked with a spoiled identity because of that. And then importantly in this book, Goffman introduced this concept of self-stigma or internalized stigma, in which, you know, people start to believe these negative things about themselves and to think less of themselves due to their experiences of constantly being labeled, discriminated, and having a spoiled identity. So Lincoln Phelan elaborate on this in this paper that was an annual review of sociology in 2001. They talk about these interrelated components of stigma. So first, there's a labeling of a difference, but just because there's a difference doesn't mean that there's stigma or that there's discrimination that happens. But those differences, some differences will get linked to labels and to negative stereotypes. So these beliefs and ideas. And then there's this creation of categories, which is an us versus them. And I think probably everyone here online and in the room can think of how some kind of an example around drug use of this us versus them mentality, certainly around criminal legal system and policing. And then with that, a status loss, and then finally the actual act of discrimination. So treating somebody differently because of whatever it is that's believed. Oops. Okay, so importantly, stigma, it occurs in a context of power. So some groups have power over others. And it's a social process. So we've just laid out ways in which that happens socially. It's not a definite, and ways to know that is looking at like different societies, different behaviors or different identities are treated and thought of differently. So we know this isn't fixed. There's nothing about that that's fixed. It's about the process. And why? So why does this even exist, right? It feels like pretty awful. I can't really understand why we would even have something like this happening. Well, here's some people have been theorizing about that. And stigma serves functions in society. And again, thinking back to this power dynamic. So it can be to keep people down, which would be like exploitation and domination. So some groups have less power and resources, and stigma helps perpetuate that. So racism and sexism would be a good example of that. It could be to keep people away. So this is often referred to as like avoidance of disease. So I'm an HIV researcher. We see that people stigmatize HIV, not wanting to have HIV themselves, thinking that by some kind of contact, which is not, evidence-based, that they might get it. So that's just to keep people that have diseases away and to keep people in. And drug use stigma would be an example of that. So there are some substances that are deemed acceptable in our society to use, and there are some that are deemed not acceptable, and this is socialized. And then, of course, our legal system and our structures influence that, those socialized beliefs, right? And the certain drugs, the drugs that I usually study, which would be opioids, heroin particularly, amphetamines, those are not deemed acceptable, and we want people to stay in, right? We don't want them to be doing what we've decided is not okay. And then I'm not talking a lot about intersectionality today, but a lot of my work is really framed within intersectionality. So this idea that not just stigmatized statuses, but this overlap, right? We have many identities in who we are, many things. I tried to by giving you my academic background and my personal background, there are a lot of things that make me who I am. And all of us have that. And there are some patterns in some communities and, that happen in this will happen in larger extents. But I'm interested in that intersection about how we can look at people as a whole and processes of oppression, how those impact people and groups as a whole. And then finally, just a definition of intersectional stigma. So the first time this term was used is in this book, Workable Sisterhood by Michelle Tracy Berger. And her definition is it's the total synchronistic influence of various forms of oppression which combine and overlap to form a distinct positionality. And I want to just share with you that Berger was essentially left out of the academic discussions around intersectional stigma. So this intersectional stigma field started to grow. It's like this burgeoning field and people are talking about it, and there's no citations for Michelle Tracy Berger, who is a Black woman. And that's important because there's these systems of oppression, the overlap of sexism and racism. And then in 2022, AJPH had this special issue around intersectional stigma and discrimination. And it was really like a call out about this process of stigmatizing this woman. So every single article published had a nod to Michelle Tracy Berger and her being left out of the literature. And then this, I just pulled a quote from her article. And she says, I have discovered that my concept of intersectional stigma, a central idea from my first book, Workable Sisterhood, The Political Journey of Women with HIV/AIDS, has animated questions of the field of public health and continues to stimulate substantial interest by government agencies that include the National Institute of Health and the National Institute of Mental Health, without any attribution to my work or scholars whose work I build on. So I like to show this because oftentimes, even in, we might understand stigma, but we're thinking of it as something that happens outside there. It's this us versus them. This is happening here. And these systems of oppression impact the people around these intersections in all different ways in everyday life, right? And just to share my, definition, really focusing on drug use. This is an article that colleagues and I put together, really arguing that intersectional stigma is a fundamental cause of health disparities. So what do I mean by that? I mean that it's stigma that's creating negative health outcomes for people. It's the criminalization, which is structural stigma of drug use. It's the way people are treated in larger systems, et cetera. And here's the definition that we have in this article, where we really map out, going back to like 1860, different, not all events, that's impossible, but different like political events, legislation, et cetera, to demonstrate why stigma is a fundamental cause. And we do this separately for people that are Black or African American in this country, people that are Hispanic, and then the intersection of that and drug use. And what we show is how folks that are white get tracked into more medicalized, humane outcomes that use drugs, and those that are people of color are often more criminalized. And we do this in a much more nuanced way. But here's our definition. Key to the intersectional stigma framework is the notion that when people occupy more than one stigmatized status, they can be scapegoated on either one or all of these statuses, and societal mechanisms can be employed similarly. That is, drug use stigma, race and ethnicity stigma, or some combination can be employed at any time. Life at the intersection is a unique oppression that is reinforced and reproduced via flexible mechanisms that change over time. And thus, intersectional stigma is a fundamental cause. And what we do with those outlines is we are showing how those mechanisms are clearly changing, but the result remains the same. Okay, so stigma is pretty hard to measure, but we have good measures, quantitative measures. But there's other ways that we could talk about stigma. And what I want to talk about is photo voice today. And what is photo voice? It's an inclusive and participatory research and advocacy methodology that amplifies community voices through captioned photographs taken by community members themselves. It creates opportunities to raise awareness about the lives and concerns of individuals and groups in creative, action-oriented ways. Okay, so here's the real seminal article on that. Wang and Burris formalized this approach and named it Photo Voice in 1997. In this article, really talking about a needs assessment. And let's kind of take a minute to talk about the roots of photo voice. So it draws heavily on the ideas of Freire's critical pedagogy, which you can find in the book here, Pedagogy of the Oppressed. I'm not sure how many folks have read that, but it's fantastic, so I highly recommend it. So this philosophy emphasizes the importance of dialogue, reflection, and action. In the context of photo voice, this means engaging participants in a process where they not only create visual data, which in our case is photos, but also critically reflect on the meanings and share them with others for collective action. So this aligns with Photo Voice's goal of empowering participants, especially those from marginalized communities, by giving them tools to articulate their experience and advocate for change. So just to kind of break this down a little bit into parts. So this is participatory photography. So it combines photography and participatory research together, enabling folks to be like active researchers themselves, to be active in this process. So they're not just subjects of research, they're co-creators. It's really accessible, and it's a creative approach to community engagement. So one thing about Photo Voice, and as somebody who's done it, it's incredibly accessible to people. People like taking photographs. They don't have to answer surveys they may not understand the language on. They don't have to read the survey if they can't read. They don't have to articulate themselves in a language that might not be their first language, or in a way with somebody they might not feel comfortable with, like an academic, right? So they can just kind of use their own means of talking, and it's incredibly, incredibly accessible. And it incorporates visual materials into collective analysis and action, right? So this isn't just a methodology, but this is about social justice. This is about action. And this is about co-creation of knowledge. Okay. So going back to Wang and Burris, really the most talked about method for Photo Voice is the showed method. And it has these steps. So somebody would, groups will go take photos. You come back, you talk about these photos, and you ask these questions. What do you see in this photograph? What is happening in this photograph? How does that relate to our lives? Why are these patterns and themes sustained? So you see this kind of like individual approach. Okay, so now we're looking at patterns and themes. That now we're looking at it more like collective, right? How can we positively change this with our new social conscience and education? And then what can we do? So like moving to action. That's a lot of questions. I mean, maybe doesn't feel like a lot to you, but it kind of, it can be. So what we did is we used a different method. I brought for these projects, we brought in an expert facilitator who has condensed the showed method into what we call the ORA, the observe, reflect, alternatives, or act method. And we really only ask like 3 sets of questions. So you have these buckets, and it allows participants to lead the conversation in ways that you have more questions doesn't. So those of us that have done qualitative work probably know like the less questions you have, or if you can like skip around a little bit and let the participant guide that conversation, the better the data is and the more comfortable the participant is, et cetera. So this is what that's doing. So, someone comes in with their photo that we ask them to just kind of observe. So what, like looking at the 5 senses, the touch, smell, taste, hear, it's really individual. So what do you want to show in the photo? Like, what did you think about when you took that photo? We continue to probe until the story is told. And then we ask them to reflect. And this is really moving to that micro social. So how does this relate to you and your community? Why is this message important? Like, why did you take this, photo? And then the action piece. And, everyone's kind of just getting themselves to this last. It's a very natural flowing conversation in small groups that gets us to this future actions. So like, what actions would help improve this situation? That's one thing we ask people. How can policymakers change the situation for the better? I usually would ask something just even more condensed, like, what do you want people to know? Like, what do you want to change in your life? What's going to make your life better? Those types of things. And so these are pilot projects that I'm going to talk about today. Really done on a shoestring budget, but we did it, and they were powerful and beautiful. And we'll talk more about some future plans. So this was collected in 2024, 4 sessions. So kind of overlapped between June and July. We had once a week group sessions totaling 4 sessions with 2 different groups. One in Harlem, which was conducted in English with 12 people, and then one in Washington Heights, which was conducted solely in Spanish with 12 other people. And our partner was On Point, New York City, which is the first publicly recognized overdose prevention center. So I'll just share with you the aims of the project now. So we were really interested in exploring. So my work always is looking at strengths-based approaches, not just barriers. So I'm always interested. I'm very interested in social networks. I'm not going to talk about that today, but I was interested in, what are the community sports? What brings joy to people's lives? And what are the social networks? And understanding these types of things can help us in our interventions, because we can really amplify what's already happening, what's already good. And that can help us help other people improve their health outcomes. But we do also need to know barriers. So also thinking about exploring multi-level barriers and facilitators. So remember, I'm an HIV researcher of PrEP, harm reduction, and OPC use. And I want to also just mention, as we go through this, nobody took pictures of injecting at the OPC. That might be, as a researcher, my big interest, but that is not the main aspect of their lives. And that's one of the beauties of Photo Voice. It allows people to tell us what is important. And if we are going to really create interventions for people and for groups, if we don't understand what's important for them, our interventions are not going to work. Okay, so here's one of the beautiful photos that our participant took of street art. So I'm going to talk about the visual data and the ethnographic reflections. And I'm first gonna, I'm putting this in two buckets. First, which was the most pronounced theme, was around structural violence, right? So how intersectional stigma produces structural violence. And structural violence isn't just about isolated acts of harm. It's about the systems that quietly but powerfully shape really who lives and who dies. So this was first introduced by Johan Goltung, and it was this concept of structural violence, defining it as the harm that occurs when social structures or institutions prevent individuals or groups from reaching their full potential. Unlike direct or personal violence, structural violence is often invisible, indirect, and normalized within society. It shows up as systemic inequality in access to healthcare, housing, education, and safety, where outcomes are avoidable but persist due to unequal power and resource distribution. So like hearkening back to that intersectional stigma discussion we had. So he had argued that peace should not only be understood as absence of war or direct violence, but also as the presence of social justice and equality. So that is referred to as positive peace. Structural violence becomes visible through disparities in health, mortality, and opportunities, and it's deeply embedded in the systems we rely on daily. And I just, put a few bullet points up here to kind of guide us and remind us that structural violence can be invisible. It may not be invisible to some of us in the room as we're aware of things that are going on, but it can be invisible to many people, including the people experiencing it. So it's not someone hitting you, it's being denied shelter, medical care, safety because of who you are, and how those systems are designed. It's also chronic, so it manifests over time through poor health, poverty, shortened life expectancy, and it really reproduces and reinforces inequalities in society across, race, class, gender, and other statuses that are systematically oppressed. So I put the systematically oppressed there because it's not somebody's race or gender that creates their health outcome. It's really the system of oppression of racism and sexism that is influencing their outcomes in society and their health. And so now we're into the data. These are, the next few photos I'm going to share are really in that bucket of structural violence. And to walk you through how this happened and how these photos came to be, we had those 4 sessions. Folks were trained in photography. I mean, everyone pretty much knows how to take a photo. They were given cameras if they, wanted to use those cameras, and they'd bring them back and we would download it, and we'd go through this whole process of deciding as a group what photos represented everyone. So someone might really love their photo, but it doesn't represent the group, so it doesn't really make the cut for our photo gallery. We also work with them on titling the photo. So this misplaced focus, this is not an academic title. This is what our community has decided. The description comes through that ORA process that I talked with you about. We write everything down just for an equity piece. We don't ask anyone to take notes, so nobody has to out themselves if they can't take notes. We do all of that, but they decide on how the descriptions are written, and we have a lot of community checking. So at every single session, we go through what we've already decided on. Changes are made in real time. And then the alternatives is really like that piece of action of what do you want to see happen. So for this one, this is misplaced focus. And the description is: the image shows an X-ray machine at the building's entrance, a homeless shelter, highlighting the management's focus on security. While this provides some safety, it also raises questions about misplaced priorities. Residents, especially persons who use drugs, may feel that resources would be better spent on medical support and community services. And the alternatives, what they want to see happen is to assess and identify the real needs of the population, such as healthcare and support services. The next one is safety is relative, and then urban shelter. This photograph was taken by a Washington Heights participant, and he talked about being up for 48 hours and just being so relieved when he saw this bed, which is it's like under, you can kind of see the freeway under an overpass. It's an area that we do a lot of outreach in. I go out with the outreach team, so we walk through. It's kind of like a urban skate park, like that's been made that way. But he was just super relieved. And the description is: this is a safe place to stay dry and comfortable during the rain, or a cool place during the summer, depending on the observer's mindset. On the street, one lives with one eye open and one eye closed. Sleeping where people walk by is the safest place. And the alternatives are: locate places that do not force people who use drugs to go to a shelter. So I intentionally put this after the shelter photo, because who wants to walk in to their home and be surveilled at that level? Plus, there was a lot of discussion around how shelters were not safe anyway, and that people didn't want to be in there. And there's a whole bunch of other issues around that, and around time being taken away towards their single occupancy rooms and all this other kind of like bureaucratic stuff. And then there's the other, alternative is to work on the infrastructure and safety of shelters offered in the city. The next one here is accessibility versus limitation. It's forbidden market. So you can see this is a, kind of a beautiful photo of the typical New York street corner where there's a vendor selling food. And the description here is: what represents accessibility for one person represents limitation for another. So the people that were taking these photos couldn't buy the food here, right? The abundance of people who use drugs is represented in the leftovers of others. The feeling of conflict between the desire to enjoy the pleasures of food and the reality of addiction is a permanent reality. And what this person in this group is talking about is the pain of withdrawal and having to decide with food insecurity what you're going to do. Do you want to not go through withdrawal, or do you want to buy a piece of food? And usually it's going to not be to withdraw, which seems pretty rational. And then the alternatives are to improve food banks. So can they, have food that maybe doesn't cost, partner with organizations for a food supply, restaurants, hotels, and churches. And I just learned of a really cool organization here in LA that is redistributing food from like entertainment events and bringing it to people. So that's a new organization that is coming up, and to promote cooking workshops, food and nutrition fairs, and home or community gardens. The last photo I want to share around structural violence is titled Barefoot Battle. This is one of my favorite photos because I think it's beautifully artistic. And the description is lack of access to shoes and clothing increases the risk for skin conditions and infections. Feet are the means of transportation. These tell the experience and struggles of daily life. My feet can tell my story. And the alternatives is to promote the collaboration between community organizations to provide donations such as clothing, shoes, and personal essentials. I'll just stop there. So I'd like to end on more positive notes. So we're going to just take a minute to think about resilience and joy, and ultimately think about if we can address structural violence and intersectional stigma and how that is so intertwined, people can live like healthier, more fulfilling lives and have more experiences of joy. And I think, hopefully you'll agree that this gives us some ideas of what might we do as a society to get there. This is titled Serenity. This person loved his cat very, very much. He was unable to have a pet until he had a single occupancy room. So this was really a big deal. And the description is the image highlights the bond humans have with their animals and how animals don't judge, but rather love unconditionally. The responsibility of having a pet encourages a sense of purpose and meaning. And this participant talked a great deal about how having that companionship helped in their, they were on methadones, helped in their treatments, really stabilizing them, having stable housing, which I think most of us know, like housing first initiatives are quite successful. And that's really the alternative, have permanent housing. And for this person, it's a permanent housing that allows for pets because he never was able to have a pet. So, I'll just, elaborate permanent housing that allows people to live their lives as they choose to live their lives, whatever that may be. And the last one is echo of support. One of the participants, this is the Washington Heights on point, because there's two. They came together. They were two organizations that came together and rebranded when they opened their OPC, which is just, again, one space in a larger harm reduction agency that does a lot of work, and a place where people can take pre-obtained drugs. So they get their drugs outside and they can use them under a supervision to prevent overdose. So for the group, this description is a home that is not a home, spaces to rest, take refuge, and resolve critical moments of life on the street. People with a different mindset who also make an effort in the battle against drugs represent institutions that must grow. And the people they're talking about are the staff at On Point, that they want to see more of this. So the alternatives the group decided on were to improve care programs. And I think they intentionally said it like that because as whole people, like I said, the OPC is one space. Nobody took pictures of that. That is just like one part of their identity. And there's a lot of other needs that are coming first, right? And I think the structural violence piece kind of really laid that out for all of us. To seek larger and more sustainable funding. So our participants were very aware that we needed more funding for On Point, that not being able to go on the weekends or during certain hours was a real constraint because they might have needed it. And the idea that people are only, like, if we're just even thinking about the OPC, people only inject during hours of operation is not real. And we want to save lives at all hours, right? On the weekends too. And then to strengthen work teams and human relations. So have people that are caring and loving, interact with them, that can understand their particular life circumstances and experiences. So for Photo Voice, there's the piece where you work with your participants that often builds resilience, creates a better self-worth, destigmatizes internalized stigma. But there's this other piece, and this piece I'm really interested in is reducing community stigma. And how do we do that is we amplify voices of the people that participated. This is one example of a gallery where On Point hosted a care fair that was in Harlem in the community. And we were just out on the street showcasing the photos of this project, and people walked by and could interact, ask questions. And we also had participants come. So participants that took these photos, sometimes we might say activist artists, they were able to talk with people and answer questions. And that contact, what this is really doing is testing the contact theory. That contact with people that are different reduces stigma towards those groups, right? And it was, pretty successful, and we're continuing to do that. And one thing I did not say is that we have, at the beginning, we set these agreements, and it's a community-based approach. So the group decides on how, what's acceptable in the group. So if participants are late that day, are they able to come in? Are we doing a break every hour so everyone can go inject? Are we, does everyone have to stay to the end if we do that break? So those are all those things. But we are, as researchers in that space, part of the community too. And what are our agreements and obligations? So one of the one agreement that the group asked of us is that we share these photos widely and largely. So that is what I am trying to do. This is just one example. I'm doing this today, and it's a really huge thanks to USC for hosting me, because you're allowing me to, hold my agreement. So in conclusion, just to wrap this up for everyone, photo voice can be useful in research. It can really help illuminate some complex issues, and it allows for us to look at things from the eyes of the folks we're working with. We might not know what the big issue is, and I think having the humility to understand that and allow people to tell us it's incredibly important, because if we're asking the wrong question, we're not going to ever get the answers. So by centering community voices, we shift power dynamics in research, which is important. We uncover unlooked barriers and sources of resilience. Again, we can build interventions that harness these tools and the power within the community already, and drive solutions that reflect the community's truth. So what is it that's important to them? That's ultimately what we need to work with, right? And then just a quote, one of the participants at the photo gallery was talking, and he was just saying, these aren't just any photos, these are our photos, like there's such a pride. And it was really just quite beautiful to see that transformation. Okay, so where am I going? So future directions, I believe that photo voice can be a tool to reduce stigma on multiple levels of society. So yes, people that go through this might have reductions in individual stigma or self-stigma, right? But ultimately, I'm interested in structural change and changing the ways in which these systems are oppressing these people, not just these people or us changing, right? Like people that are facing discrimination. So I want this to move to the community level with the galleries and test whether that is reducing people's in groups that tend to stigmatize people that use drugs. Is that going to change their stereotypes, their prejudice, and ultimately the acts of discrimination? And can it change policy? Another, I'm interested in that as a RCT, a randomized control trial, but, photo voice can be integrated in any other study. And it's an opportunity to engage community members, to hear their voices, to do needs assessments, to understand what quantitative questions we're asking in surveys. So I think there's a space for photo voice really in anything. And then for me, as I mentioned earlier, I'm from California, and I love California. And I love harm reduction, and I also love my faith. So I am working to build a program here in Los Angeles, working with the Sidewalk Project. We have a grant under review with Jimmy here, looking at social network intervention, getting people linked into PrEP and MOUD. Again, harnessing the strengths of the community, and then also working with the Daughters of Charity that have a ton of work and ministries with people that are experiencing homelessness, experiencing poverty, using people that use drugs, and working within those, those systems to help link people into care. And we're not in the best time for this. So, I think one way forward for all of us is to work together and to find some collective action and to find ways to serve the communities. Everyone pitches in a little bit that we want to serve. But I also want to share this photo from one of my ethnographic routes or observations, and I was really struck by it because it's outside a church and there's this banner, and then to the right is a home. That's the home somebody has created. And of course I intentionally just took a picture of the home, not taking the picture of the person. And this banner, it's a quote, and I'm going to read part of that quote, which is to the right here, and it's: "Capitalism does not permit an even flow of economic resources. With the system, a small privileged few are rich beyond conscience, and almost all others are doomed to be poor at some level." And I want to, leave us with that thought as we enter into, another difficult year and challenging time, and acknowledge, the funders that funded this, and NIDA grants, and the UCSF program, and particularly UCSF program, and CEDAR. The community partner on point who graciously gave us space without asking any money, because these were pilot projects, helped us, decide on who's going to be part of the study, help us giving us resources to, find folks if they weren't there, so we could go get them. Although as an ethnographer, I kind of knew where people were living, so we would go walk by and grab them. Our research team, and of course the participants for sharing their lives. And thank you. May we have peace, my two little girls. I'll stop here, and I'd love to take any thoughts or questions. Yes, Sarah.
Yeah, no, thanks so much. It was, great hear about your research, and also, to combine it with theory and really this human story. So thanks for the talk. Just to ask you a bit more about the photo voice and where you're taking it with the community evaluation. Because I think, we've done some evaluations too, trying to look at living library evaluation and a bit of photo voice in relation to mental illness in different settings, so in Nepal and China. And I think what you share, there's the self-stigma and the empowerment, or internalized and the empowerment aspect, which is, in terms of feasibility, is easier to track. And the RCT is really interesting. It's always been a struggle that challenge that I've struggled with too, in terms of thinking about how you can evidence this kind of even community change. I just wanted to hear a bit more about your thoughts of how you are thinking about designing that in the process. What you think would.
Well, so we would do an equal attention control. But I would say the individual piece is probably easier to measure, right? Because we have multiple touch points. We can, we have all these, we can measure empowerment, we can measure reductions in internalized stigma. It's pretty robust literature on those measures. The community piece, we certainly can measure to see if people's attitudes are changing, but it's very hard to fund something longitudinally to see if people's acts are changing, or is the policy landscape changing, and was it really because of this gallery? So I probably shouldn't even be saying that. I feel like that it's under review, and I want to say it's completely solid, but that is, I think, the harder point. And a lot of it also is just, there's just not enough funding to have these longitudinal studies all the time, you know, so a single point intervention or a single contact is, you know, within our funding stream, right? But we know that it's really multiple touch points that are more effective for interventions, right? So I'm trying to think of ways in having like asynchronistic touch points after a gallery, for example, because certain people that are coming to galleries, maybe they're in medicine or they're, you know, policymakers, they're not going to come and have in-person workshops or do what we might generally do in terms of like a follow-up survey, right? So how, you know, trying to think of more creative ways to assess that. And hopefully it gets funded and, you know, the shortfalls we'll address in the next study because we'll always find something. Yeah.
Chime in.
Thank you.
Thank you so much for this presentation. I should start, I guess, by introducing myself. My name is Marcia Franklin, and I'm a PhD candidate here at USC in the Chan Division of Occupational Science and Occupational Therapy. And a lot of my dissertation, well, a phase of my dissertation is using photo voice. And I'm looking at the experiences of Black neurodivergent women in higher education.
Nice.
And so it really resonated with me. I'm more so looking at the belonging in. But your work in this intersectional stigma, I believe it is, has me really thinking about ways that I need to perhaps think deeper. And then on top of the dissertation things, one of the things that I've kind of brought to my advisor this year is to begin a course, a photo voice course here on campus where we're using photo voice working with community partners. Because I believe we have one on campus, but I'm not sure if we're actually working in community. And so one of the things that I was thinking about as you talked about the SHOWED method and you kind of revised it to, I'm not sure if you called it the aura or the ORA.
Yeah,
Okay.
I say ORA, but like I think I probably should move to aura because all my students are saying aura now. So I'm like, okay, it's aura. I know.
I really love how you tailored that for your participants. Do you have any, is it published that I could also cite that in some of my work or?
Yeah, so not, we'll probably publish the first methods paper on that in more depth. It's drafted and sitting with me, I will admit. But it will get there. There are other papers that I can send you that reference it. So we brought in an expert facilitator who's bilingual.
Okay.
And that group, so I mentioned I learned about this at UCSF. Mark Padilla from FIU talked about it. He was a visiting mentor that year. And he's done a lot of work in Dominican Republic and Puerto Rico using photo voice. So I can send you those. But the way to do ORA isn't outlined, but will be.
Okay.
In the
that
methods
would be
paper, yeah.
Amazing. And then I had one more brief question.
Yeah.
I noticed in the photos that most of the participants did not take pictures of other people. Did you provide those guidelines from them at the start of the process?
That was not an agreement.
Oh, okay.
So some people did pick, I mean, we said, okay, we don't take a picture of someone unless we did say that, unless they agree. So there was like one photo of one of the participants' wife shooting up. So, you know, we blurred out faces,
Okay.
but for the most part, people actually didn't take pictures of people.
Okay.
Which was really interesting. Like there's some, I couldn't put everything. There were some really cool photos. And this morning over breakfast, we were looking at a video because I'm staying, where am I staying exactly, sister? What is like your neighborhood? I'm staying with the daughters. Okay, so I'm staying there and there was someone who like bashed a fire hydrant and they were saying about showers and we have a picture of that. Somebody took a picture because that's like for them, water is, you know, we think water is so easy to get, right? But it's not easy to get and that is like a life force and it's sitting there and it's inaccessible. Like, can you imagine how awful that is, you know? But so that's one of the photos. Yeah.
That's amazing. Thank you.
Mm-hmm. I was like, Steve, this is not you. You're always.
So, I had never heard this photo voice stuff before, and I think it's really cool. I'm glad I came and got to hear about it, because it's a really interesting, novel technique for collecting data out of the, out of the box in a very different way. As I was listening to your talk, I think I was having very first world thoughts about what to do with these pictures. We all live in LA, we live in this very capitalist world, and so it's like, whoa, put them in a gallery, put them in a book, and all these things. But it kind of gets at the question of who needs to see these photographs, and beyond the research community, who needs to see these, and what are your thoughts about? Because it reminds me. This is a long lead up to a question. It reminds me of a photo essay that was done many years ago called The Innocents by Karen Simon. She took photographs of various people who had been convicted of crimes that they hadn't committed, and they had spent decades in prison. And it's a gorgeous book. And there was a gallery opening in various places. And I just thought it was magnificent. Of course, I would, because that's an area, But I sort of rambling onto a long question. What do you do with these photographs that are both, they're artistic, they're really gorgeous, and they really pack a punch in terms of understanding the lives of people who are not like us.
Yeah. As Kendrick Lamar would say, by the way. Not like us. Okay, so I, after the Super Bowl, clearly went down that road with all the other suburban moms, I'll just say. Okay, so what do we do? Just kind of hearkening back to my agreement. I said I would distribute these as widely as I can. I recognize that academic settings aren't always where that should be. So the photo I had up, that was at a community fair. We've done galleries at, academic conferences, which, it's not always like-minded people. People study a lot of different things and hold a lot of different stigmas. And I hope with the burger stuff kind of touched on that a little bit. So we've done that. I'm going to be we are going to host a gallery at NYU and, be inviting policymakers, other community members. This could be, like an academic detailing kind of project that these could get, maybe to, shared or, to destigmatize healthcare, workers' perceptions of people who use drugs, for example. But back to the reality is like, I'm only one me. I'm an assistant professor. I have a team, but not a huge team. The funding is small. We're all experiencing funding cuts. But I'm also willing to, lend these to people if they're open to putting them up. So I've been reaching out to other organizations and I'm like, listen, I already paid, this is paid for. Here's the data. Do you want to use this in your campaigns? I don't want any money for it. I just want you to, get it out. So I think there's possibilities. I hope they come, to fruition. And I hope that we can share these lives with more people.
I think too that photography, it's so interesting. You start with stigma. And then when you go through the photos, they lose their stigma. Because you get to see the humanness, the experience, even if the person is not there, you see the person in that picture. What a powerful way to bring something from the inside of a person to the outside of the person. I'm more excited about education at lower levels. This is your academia, but we work with kids. And how do we get the next generation to not adopt the stigmas? How do we do that? Sometimes it's hard to move the stigma from people who believe so greatly in what they believe, but what do we do with younger people? So any opportunity where we have kids gathering, Sister Lisa. She does this program called Charity Vision, which is kind of similar in a way. You want to talk about Charity Vision? And why you don't particularly, but.
Actually, we did talk about it. Susie and I talked about Charity Vision.
But the idea is to get people to think about a picture and the deeper meaning behind the picture. What do you see and then what is
Yeah.
else is going on kind of a thing. But I see the great potential of that. So
Yeah.
grab anything and any place you can go. Look for invitations that are free, whatever, just show up. Just show up.
I'm gonna piggyback off this. I showed up not knowing what I was walking into. I actually had to look up Google photo voice. She mentioned education. I actually worked in a nonprofit in Long Island called New Ground.
Oh my gosh, we need to chat. So I live on Long Island and I work,
I don't know if they still do the summer photography program, but.
I do a lot of work in Nassau County, in community coalitions, yeah.
But
Wow.
20 years ago, they had this photo project for families that were previously homeless. And they gave the kids a camera
Mm-hmm.
and it gave them voice. And you say only one person, but anyone who comes to these, like me, I'm gonna give a call to New Ground and say, consider this. So thank you.
Oh my gosh, thank
for-
you.
One question online, maybe.
Thank you.
and with that,
Perfect.
Are the methods for creating community agreements also going to be in the forthcoming paper? Our team at the UCLA Integrated Substance Use and Addiction Programs is working on some CBPR evaluation projects, so I'd love to learn more about how the process worked.
Yeah, absolutely. It's there, but now that you mention it, I'll make sure it's really good in there.
Well,
Sorry,
go ahead.
do we have time?
I'm not gonna cut you off, Don. Go ahead.
I just kind of wanted to ask about this sidewalk project, Daughters of Charity kind of coalition. Could you kind of give us your vision for what would be like feasible, or maybe even just go, what would be the optimal kind of program for that, and how we actually make it translational to kind of like what we were talking about before with like policymakers, and how do you take that, whatever this coalition is going to build, how do you make it so that it produces actionable or at least influencing outcomes?
Yeah. Oh, well, so first, Todd, I want to say, I think if we developed coalitions, that might be really helpful. Because that's not what I have currently going in LA, but I think it would help all of us if we all got to the table and everyone has a skill and resource and like we put them together. So I think that's a great idea that you just came up with. So thank you. And right now, these are just NIH grant interventions looking to increase PrEP and MOUD, at least the one with the sidewalk project, because that's already under review. MOUD and PrEP uptake among people that are using drugs. So, in terms of photo voice, I think that could be a piece in that, because it gives people it empowers people, it makes them feel better about themselves, and these were pilots and it's anecdotal, but people started going into, decided they wanted to go into treatment after the photo voice sessions. And we didn't talk about treatment, that was not the goal. Really it was harm reduction and PrEP, just trying to understand barriers. So I think, using photo voice in the services that are already, we talked about that are already there. But as a scientist, measuring and understanding the effects of it and the outcomes.